Good afternoon, everybody, and thank you for coming. Thank you also for listening to a presentation in English, as my Finnish is non-existent. I will try to speak quite slowly so that to be as understandable as possible, and welcome also to the people online. I am reporting the work of myself and three colleagues. As Juha has said, myself, Dennis P. Culhane, Rita, who's here, and Marcus from Sweden, and you can see our respective university logos on the opening slide. I'm going to talk about a little bit about the review process. I will talk about some of the results of the review, but I will also try and have a bit of a wider discussion based on the report that we've done. So the review brought together academics from Finland, Sweden, UK, USA. We undertook 2 visits to Finland by the international component of the research team, and we talked to a very wide variety of people. People responsible for homelessness policy, for homelessness strategy, both at central and local government level, at the municipality level, homeless service providers, and to formerly and currently homeless people using services in Helsinki city and in other cities in Finland. And we visited homelessness projects, including specific services for particular groups of homeless people. So I, for example, went to a service working with young homeless people, also to a service working with ex-offenders who had been in prison and who'd experienced homelessness. The goals of the review were to explore the successes and also any limitations from PAVO 1 and PAVO 2 programs, to look at where further work may need to be done in terms of the future homelessness strategy, and also in particular to draw on relevant experience from Sweden, the UK and the USA that might be useful for future planning in terms of responses to homelessness, and to produce a report based on this work, which is available outside in printed form if anyone is interested in it, and also online as a PDF, and it's been published today. I'm going to start with the successes. It's always good to start with the good news. We thought that there were 3 main successes in terms of what we found and report in the report, but I also want to talk briefly about a 4th one, which is critical reflection. And these were reductions in long-term homelessness, the development of a comprehensive strategic response to homelessness, and the movement towards homelessness prevention. So there's been a substantial success in reducing long-term homelessness in Finland. Long-term homelessness, also repeat homelessness, where an individual experiences homelessness several times during the course of several years, is the most damaging form of homelessness. It's the form of homelessness that potentially causes the most damage to the individual experiencing it, in terms of representing possible risks to health, mental health, all the consequences of being without a settled home, all the stresses of being without a settled home. And also there can be associations with things like problematic drug use, experience of violence, contact with the criminal justice system, use of emergency medical services, all these kinds of experiences. For society, in terms of public expenditure, it is also the most damaging form of homelessness. If homelessness is not resolved, people can be expensive for the taxpayer because, for example, they don't have a doctor, so they go to the emergency room in the hospital when they need something. It's more expensive for them to go to the emergency room, being British I'd say the accident and emergency department in a hospital, than it is for them to use an ordinary doctor. They might not get contact with mental health services through a doctor and instead be picked up by emergency mental health services, which again is very expensive. So because they use a lot of emergency services, also if their homelessness is not resolved and they are in homeless shelters and other systems for a long period of time or on a repeated basis, they're also financially expensive. So of all the forms of homelessness that you don't want in a society, the one you don't want the most of all is long-term homelessness, recurrent homelessness. And this is where the Finnish strategy, where Paavo 1 and Paavo 2 have been most successful in bringing the levels of long-term homelessness down. This has not been accomplished on the same scale elsewhere. There have been comparable achievements. You look at, for example, in my own country, London's strategic response to long-term street homelessness, to what we call people living rough. Numbers there have been brought down. But it's not comparable with what's been achieved in Finland because it's focused on London and a few other places. And the response has been uneven to long-term homelessness in the UK. Same in the USA and the same in Sweden. So achieving this wide-scale reduction in long-term homelessness is a key achievement of what has been delivered by Paavo 1 and Paavo 2, by the homeless strategy in Finland. The use of congregate and communal models of housing first has been the subject of debate, and I'm going to talk a bit about that later on, but this strategy, its effectiveness in terms of bringing the numbers down, is clearly a very positive achievement and a success for the programme. So drawing out those international comparisons, you can say that Sweden and the UK have begun small-scale experiments with housing first services, and some successes have been achieved, though it's difficult at this point because these services are quite new to see how successful they'll be in the medium to long term. The USA has multiple examples of housing first and what they call supported housing services that have reduced long-term homelessness, but these services vary in form and function across the US. There's a lot of inconsistency in terms of what's done. And in all three countries, Sweden, UK, USA, the traditional model of response to long-term homelessness, the staircase or linear residential treatment model, remains widespread. By comparison, Finland has made an important structural shift towards a housing first approach, and that seems to have been important in terms of bringing down the numbers of long-term homelessness. And there's not been that achievement elsewhere, as I say. Another issue with the international comparison is that the Swedish, UK, USA responses have been uneven. So in the US, some states, some cities have better policies than others. A particular issue in the US is that some groups, particularly people who are veterans who've done military service and become homeless, get more help than other bits of the homeless population. So if you're long-term homeless and you're a veteran, in the USA, you have more access to services than someone who is long-term homeless and is not a veteran. As I said, we've seen various responses in the UK. The Rough Sleepers initiative, which began in London, spread out to other cities and was also repeated in Scotland, delivered substantial falls in rough sleeping, but it was not applied everywhere. And also the problem persists in the UK. So London has shifted from the Rough Sleepers initiative to the new No Second Night Out initiative. And just to re-emphasise the point I was making to begin with, the wide-scale reductions in long-term homelessness across Finland have not been achieved in these three countries. Coordination and comprehensiveness. So Finland is perhaps the best example that I know of, that we know of a national homeless strategy in terms of being comprehensive and in terms of being coordinated. It's brought together homelessness services, the Y Foundation, municipal and central government, and it's been a comprehensive response to homelessness. Alongside the focus on long-term homelessness, which I started with, there's been the development of preventative services and successes in homelessness prevention, in bringing down the risk of homelessness. That can be advice and information when people are at risk of eviction. It can be more intensive services around housing social work models when someone is vulnerable, has a support need that might make them at risk of becoming homeless. There's also been success in terms of developing specialist services for particular groups. Young people is one example, and former prisoners are another, and I'll come on and talk about those two groups and some others in a bit more detail later on. And there's also been experiments with a wide range of homelessness services beyond Housing First. So, for example, use of lower intensity models of housing support for homeless people. The Finnish strategy is more coordinated and has been more comprehensive than the equivalent strategies in Sweden, the UK and the USA. A key difference, perhaps the key difference between Finland and the three countries from which the international team came is that those countries are inconsistent in their response to homelessness. So there's good practice examples in Sweden, in the UK and the USA, but it's confined to certain geographical areas, or it's confined to certain elements of the homeless population in a way that it is not in Finland. The Finnish strategy is much more comprehensive. So you can look at examples of quite coordinated homelessness services. You look at New York or you look at London, they've got highly developed networks of homelessness services. There's at least some strategic coordination. There's involvement from city government in those two cities. But then you can find examples of cities where things are a lot less coordinated, where there's a lot less attention on housing policy in the same countries. Finland is bringing overall levels of homelessness down. Now, it's not successful in all areas, and I will talk about where there is still maybe some additional work to be done in terms of Finnish strategy and Finnish policy around homelessness. But it is the case that in many other European countries, levels of homelessness are rising, whereas they are not here. And that, again, underlines the successes that have been achieved by the homeless strategy so far. Prevention, you've got the development of specialist services to stop the association between homelessness and people leaving institutions. That's something that is not unique to Finland, that association between being in prison and being in psychiatric hospital and being at heightened risk of homelessness occurs elsewhere. But services have been developed here to focus on those issues. You've got prevention targeted at young people who are at risk of homelessness, and that, as I'll talk about a bit later on, is associated with wider social exclusion. And you've got the development of housing advice and support services that prevent eviction and are able to help arrange access to housing to avoid homelessness from occurring. So another strength has been around the development and focus on prevention that's happened so far. And internationally, Finland reflects much of the best practice in homelessness prevention that you'll find elsewhere, for example in my own country. Although Finnish services have developed independently of prevention services elsewhere, there's a lot of similarity and a lot of shared good practice between countries in terms of how thinking about preventing homelessness and how to deal with that. There's relatively little to learn from other countries because Finland already follows a lot of the successful approaches from elsewhere in terms of homelessness prevention. But I'll come on and talk a bit about recommendations towards the end of the presentation. And finally, I think it's worth saying, which is not in the report itself, critical reflection is a strength of the Finnish response to homelessness. A willingness to explore, examine, criticise existing approaches to homelessness is a major strength of Finnish national policy. Now, major shifts in homelessness policy have happened elsewhere. So you can see the move towards supported housing models like Housing First in the USA and away from treatment-led approaches to homelessness. Or the huge shift that's occurred in the UK from responses to homelessness after it has happened towards a much more preventative framework. But you do not see the same willingness to continue asking questions after policy change, to continue looking at effectiveness that you do in Finland. And that critical self-reflection, always thinking about whether or not your policy is the right policy, is actually a very effective way to respond to homelessness. Particularly because we are starting to understand that homelessness is not static. So if you talk about, for example, long-term homelessness, now, 20 years ago, in a lot of countries, including this one, that was a problem experienced by middle-aged men, largely, often with issues around excessive use of alcohol. But we know that that population here and in other European countries and in the US is falling. And we might be in a situation where, for example, we see people entering long-term homelessness who are more likely to be women, are more likely to be drug users, are more likely to have complex needs of a different sort, so that your response to that potential long-term homelessness 10 years from now will need to be different, maybe, from what you're doing at the minute, because we see these kinds of shifts. Another major shift that has occurred, not just here but in other European countries, particularly northwestern Europe, the most economically prosperous bit of Europe, which I'll talk about a bit later on, is the rise of migrant homelessness, people without papers, people from other European Union countries who become homeless here or in UK or in Ireland or wherever you want to talk about. So thinking about what you're doing is always a good thing, and not stopping thinking about what you're doing is always a good thing. Limitations of the Finnish strategy. I'll talk about three things here: housing supply, social integration, and also around specific groups of homeless people. So starting with housing supply. Major pressures on affordable housing supply in some areas of the country, particularly here, Helsinki City, but also other areas as well. The work of the Y Foundation and the municipalities and others is important in terms of providing new affordable housing, but capacity to meet the demand for affordable housing is limited. Responding to homelessness becomes harder in a context where affordable housing supply is not relatively plentiful. And you start to get politically difficult dilemmas arising. Homeless people need housing, but then other people, working families on low income, also need housing. And if you have one house and 5 different households who might need that house, how do you make the decision about which one gets it? So you have to think about how you manage supply, how you can increase supply without spending lots of money. Now, in some ways, I wish I was able to bring you positive news from Sweden, the UK and the USA about how to deal with affordable housing, but all 3 countries have failed to deal with providing enough affordable housing. And they've got major structural problems in their housing markets because they don't have enough reasonable affordable housing available, not just in terms of homelessness, but in terms of overall population. So we have it at population level, We have extreme effects in the most expensive housing markets, New York, London, where central London will probably be unaffordable if you're not a millionaire in the next 20 years. Yeah, it is at that level. The things are becoming extremely unaffordable, extremely expensive. And you get distortions happening. You get very, very rich people in very expensive housing and small populations who are still in social housing and nothing in between. The middle class disappears from the cities. You get those kinds of distortions happening within housing markets, and nobody's really sure how to manage it, because any one intervention tends to be quite small scale. Social housing was seen as the way forward in some countries. It was seen as the thing that you would do, but it has fallen out of favour politically and in policy terms because it was seen as also producing negative effects. Some people thought it distorted housing markets and caused problems in terms of overall delivery of housing by the private market, and the social rented sector and the private rented sector didn't work properly together. Sometimes it was seen as creating social problems, so spatial concentrations of poverty. It's also expensive to develop. Building housing is not a cheap policy response to housing demand. And there's no obvious quick fix for this. We all know what happens if you just try to have a free market in housing, which is you do get, obviously, some good housing, but where you look at where the free market actually operates in an unimpeded way, you get slums. You get that kind of problem. So where the balance lies, I'm afraid that's not somewhere where the three countries can as yet provide an answer. But nevertheless, thinking about housing supply remains crucial to future strategy around homelessness. Social integration. I work with the European Observatory on Homelessness as well as at the University of York, and we had a conference in Berlin in 2013 which said housing first, what's second? And that summarises a key issue, which is what you do in response to homelessness once housing needs have been met. If you're going to stop homelessness recurring, or if you're going to limit and hopefully reverse the damage that homelessness does to people, anything from exacerbating, making worse their health problems, through to the stigmatisation that can come when people find out you are homeless or you have been homeless, the way an employer will look at you if they hear that you've been homeless, the way a provider of education will look at you if they hear you've been homeless, the way a doctor might look at you if they hear you've been homeless. There's a lot of baggage, a lot of images attached to the idea of what a homeless person is and what characteristics they have. So in tackling homelessness and the consequences of homelessness, we also need to think about social integration. Three key areas there, which are health and well-being, social support. By that I mean connection with community, but also personal relationships, friendships, families, partners, those kinds of aspects of life, and economic integration, particularly an issue around things like youth homelessness, which is associated with economic and social position. Now, what's been controversial, or partly controversial, in the past international examinations of the Finnish homeless strategy was a colleague of mine and another person came across from the US, looked at what was being done around housing first and said, you're putting a lot of your housing first into one big building. You shouldn't be doing that. You should be scattering it across the community, because if people are scattered across the community, they will be more likely to be socially integrated. So you had separate, large apartment buildings only occupied by formerly homeless people, physically separated from the community. And some people interpreted that as saying that's going to make social integration more difficult. You may be meeting the housing need, but not maybe the social need, the economic need. So these criticisms have been levelled at it. Looking at that from an international perspective, that idea, it's not that straightforward, it's not that simple to say that if you put people into scattered housing, you will automatically get better social integration than if you use a communal model where you have people in one big apartment block. Now, living in ordinary scattered housing might be positive and might help lead to social integration. But we also know from experience from the UK research that being in scattered housing, in your own apartment, surrounded by people who've never experienced homelessness, can also be an isolating experience. And some UK research has shown can result in persecution of that person. Some neighbourhoods are, and this is a mental health, kind of a mental health term, some neighbourhoods are toxic to people who are vulnerable because those neighbourhoods do not have social capital and social cohesion. So you need to think about, it's all very well putting people into housing in the community, but is that housing suitable? So the idea that housing is a first step towards social integration does have some research support, but whether housing in itself is enough is debatable. I think I should also add there that the idea that if you put people in a communal setting of housing first, that you then cannot connect those people to the neighbourhood, assumes that the structure of the building is the thing that dominates what the social relationships will be. And I don't think we can make that assumption. I think you can manage relationships with the community potentially. There's also the potential for communal models, group models of housing first, to be sources of social support in themselves, so that people can support each other in those environments as well. So it's never going to be as simple as big building bad, scattered housing good. It's not that simple. But with both responses, whether you're talking about a communal response or scattered housing, you always need to be thinking about how the social integration is going to work, how the other consequences of homelessness, apart from the loss of housing, are going to be managed and limited and hopefully overcome. Where we've got to in the UK around social integration is starting to think about that in terms of needing specific services. So, for example, myself and a colleague, my colleague Jan Bretherton and I are working on evaluation of a thing called the Crisis Skylight Programme. That's a homelessness service, but it's a homelessness service that only focuses on education, training and employment. It has support services attached to it, so it will connect people to mental health services, it will connect people up to a doctor and so on, but its focus is education, training and employment. That's what it does. It doesn't have a housing function as such. It might help out with housing and would have some support around housing, but its primary function is social integration. Now, emerging evidence suggests that might be the way to go, that actually moving to a point where homeless people are brought back into society in an economic sense, in a social sense, as citizens, as people with relationships, may need dedicated additional support. Now, it might be that you add to housing first services or to other services, or it might be that you run those services separately. But it needs particular attention if you're going to promote social integration for homeless people. Even when you have specialist services, it can still be an uphill struggle, can still be difficult. There can be many barriers to social integration around support needs, mental health, physical health, drug and alcohol use, or just simply having been or being homeless as something that stigmatises people, that keeps them, that means the employer or the education provider or whoever looks at 5 applications, one is from a homeless person or an ex-homeless person, it's that application that goes in the bin without the person being met, because of all the ideas about what homelessness is from popular culture and so on. Nevertheless, despite there being these difficulties, it is possible to achieve successes, and we know that there can be ways forward in terms of bringing people not only into housing but back into community, back into society. And the third set of limitations, issues still to be thought about and addressed around specific groups of people. Migrant homelessness, where there are dilemmas around finding humanitarian responses to migrant homelessness. Women's experience of homelessness, which might mean that some needs are not being recognised and met. The association between ex-offenders, people who've been in prison, and homelessness, and breaking that association, and around youth homelessness, which is linked to wider problems of social integration. Around migrant homelessness, Sweden and the UK share the same dilemmas as occur in Finland. To summarise that dilemma is to say, where somebody is not a Finnish citizen and they experience homelessness in Finland, how do you balance having a humanitarian response to that person against getting yourself into a position where you are effectively importing a social problem, where you're actually saying, if someone becomes homeless here, we will provide them with many services, when you've got your own citizens potentially experiencing homelessness. So how do you respond in a humanitarian way against the fact that this is not your citizen? How do you find that balance? Now, some of what's been done in the UK around what is called reconnection services. Reconnection is it's one of those terms that's designed to politically soften something. So like when Americans bomb something and they say, take out rather than kill, reconnection is a soft way of saying repatriation, because that's what these services do. So they find someone who is a citizen from another EU country, and the response ultimately is to put them on a plane or a boat back to that country. Now some may say, you know, this can be done in a sensitive way, in a humanitarian way, but others would say, is that the right thing to do? Is that a questionable thing to do? And it's not a straightforward dilemma, but there are real issues about how you think about migrant homelessness and how you respond to it. Women's experience of homelessness. Now there's growing evidence that women don't respond to homelessness in necessarily the same way as men do. One of the key things that seems to be a difference in several countries where research has been done is that women respond to a situation of homelessness, or are more likely to, through forming or drawing on an existing relationship. So if they find themselves homeless or at risk of homeless, they're more likely than men to use an acquaintance, a friend or family as a way to deal with that homelessness, to put a roof over their head, than they are necessarily to go to a service. Which means that our picture of homelessness, which is quite often derived from looking at who uses particularly emergency homelessness services, and it's a lot of men, may not be accurate. There's actually a female homeless population that we might be missing in terms of hidden homelessness and in terms of how women are responding to it. And there's been some work by my colleague Paula Mayock in Ireland indicating that very vulnerable women with very high support needs long-term homeless in effect, are within that population using these informal arrangements. So people with women with high needs may be within this group. There's growing attention on this. Some of my colleagues, Joanne Bretherton and Paula Mayock, have set up Women's Homelessness in Europe Network, or WEN for short. Do please have a look at their website, and there's work going on around experience of women in homelessness. But it may be something where there needs to be looked at specifically in relation to Finland, because there may be elements of homelessness, and particularly high need homelessness, that may be being missed among women. Finland already has comprehensive services focusing on preventing homelessness amongst former offenders, among people who've been in prison. Sweden, UK, USA have developed similar responses. Some evidence suggests that comprehensive, coordinated responses are the most effective. It goes back to what I was saying earlier on about social integration. So you can't just think about the housing need, you have to think about the economic and social position of offenders, ex-prisoners, if you're going to tackle the association between being in prison and a heightened risk of homelessness. So the more comprehensive you are in your response to potential homelessness or actual homelessness amongst people who've been in prison, the less likely they are to become homeless. The other potential dividend, the other potential positive from that, is they may also then be less likely to reoffend and go back into prison if they have comprehensive support. This again, it's thinking beyond the housing, is it a wider social life, economic position, being a citizen in Finland. Youth homelessness. Similar issues exist in many countries. Youth homelessness tends to be linked to groups of young people who are not socially integrated. Often that lack of social integration begins in childhood. It can be that the children who experience disruption in their lives as young children, relationship breakdowns, difficult economic circumstances where they're growing up. There's an association in many countries between experience of social work, child protection systems, and later experience of youth homelessness. So you have to think about the relationship between the marginalised, excluded child, who then might be more likely to become a young homeless person. And again, the more comprehensive you are, the more you think about social, economic position alongside housing need, the more likely you are to be successful in both preventing and reducing that form of homelessness. So all around these social integration issues, around not thinking beyond housing and thinking about wider economic and social position as well as the housing need. Because in some ways the housing need, the homelessness, is one part, one manifestation of a bigger social problem that this group of young people is experiencing. It may be very important to tackle this particular problem, because my colleague Dennis Culhane, who was a member of the review team, has been doing work suggesting that it's this group of young homeless people who actually then eventually become the long-term homeless population. If you don't intervene now when they're 21, you could be dealing with a much more complex problem and a much higher level of need when they're 41 if you don't do something now. So again, this links back to the kind of wider theme of prevention. And then finally, some recommendations. Really drawing on what I've been saying so far. Increasing affordable housing supply is key to reducing and preventing homelessness. Need to think about the high pressure housing markets like Helsinki City. They're a particular concern. Beyond housing supply itself, it's also very important to think about partnership working, making sure there are clear connections between homelessness services and potential sources of housing. A key one of those is social housing providers, municipalities, the Y Foundation. But you've got to have both as much affordable housing supply as you can manage and good connections between homelessness services and that housing supply to both prevent and reduce homelessness. And we can look at, and we talk about it in the report a little bit, you can look at some ways in which it's possible to use the private rented sector, such as local lettings agencies from the UK, which work by connecting with private landlords, reassuring private landlords, and also ensuring that the standards and the security of private rented accommodation is okay, and then placing homeless people into that accommodation. That's something that's become necessary in the UK as social housing supply has fallen relative to demand, and we've had to make more and more use of the private rented sector. In the USA, they have to work with the private rented sector because there is no real social rented sector. It's a very small part of the total stock. So you can look at alternatives. You can look at how you might use the private rented sector in a positive way to increase affordable housing supply and solutions around homelessness. Prevention. Now, it is difficult, if not maybe impossible, to accurately predict who exactly will become homeless at what point. But we do know in relation to long-term homelessness that things like severe mental illness, contact with the criminal justice system, drug and alcohol use, problematic drug and alcohol use, sometimes things like learning difficulties or brain injury, and particularly where several of those needs exist together in one person, the risk of long-term homelessness can be higher. So while you can't necessarily predict which person that uses drugs and has a mental health problem will become homeless, you can at least say that population is at higher risk, and think about homelessness prevention and targeting of prevention in those terms. You can use some of the service models that are used to reduce homelessness amongst vulnerable groups in a preventative way. So you can look at critical time intervention experiments in the US and Denmark. You can look at how housing first services might be used preventatively as well to stop long-term homelessness from occurring. Where homelessness is not associated with support needs, so where someone doesn't have mental health problems or doesn't use drugs or anything like that, risks are associated around financial factors. So indebtedness, rent arrears, the risk of eviction. You can use services to target those potential causes of homelessness. This is something that already happens in Finland, but again, it's an area where, where targeting is a very good idea. And there's scope to use other ways of preventing homelessness. You could look at using some of the lower intensity models of support, where it's not intensive like Housing First is, but there is some help, advice and support available to people who are at risk of homelessness as another means to prevent homelessness. And really, going back to what I've been talking about under a lot of these slides, which is the point that housing in its own isn't enough to solve homelessness. And revisiting this point that you have to think about social integration in the sense of, where possible, an emotionally rewarding personal life, work, education, training, or at least something positive to structure your life around. Community integration. Both the Finnish evidence that there is and also the global evidence points to this as being the best solution to homelessness. So you meet the housing need, but then you have to think about these other things that often accompany homelessness, and that's the way to ultimately deal with it. And then as a researcher, I would say this: there's always scope to improve the evidence base, to look at homelessness services, to think about what's effective. Now, a particular strength of what's happened so far in Finland has been this willingness to think critically, this willingness to keep asking questions about whether or not you're doing the right thing. Keep doing that, because that's a really positive strength of the programme. Thanks very much for listening. There's all our contact details. We really enjoyed the opportunity to do this piece of work, so thank you very much.